For those of you that don't know me, I'm Doug Mann. I'm a past chair of the hospital board, and for many years, off and on, the hospital has been trying to establish some sort of medical arts building on the hospital lands. We have land here for that building, and we have land for additional development as well across the road. And we've been meeting now for about 3 months with the Northumberland Family Health team that's led by Dr. Mark Isak, working in a collaborative relationship to develop a building, either 2 or 3 stories. We're expecting 2 stories, square footage approximately 40 to 50,000 square feet. And we can show you where afterwards, but located just behind me here in the northwest corner, basically, of the present parking lot. Preliminary, and I stress the word preliminary, cost estimates will be about $10 million. And we have been seeking the necessary approvals. We have verbal approvals from the many people that in the process, and final approvals, so have to be design drawings done, so there'll be a lot of engineering and architectural work to be done in the new year. The family health team would like to move in November of 2016, so to meet that deadline, construction must start by about September of 2015, and so we're on a fairly tight timeline to get all the processes in order. I refer to these as sort of like traffic lights in an intersection. We have to go through many different intersections. So far we're getting green lights at every intersection, which is very encouraging. We've spoken with several bankers, and the bankers are interested in the project, which I think is great news, that they're prepared to look at loaning approximately $8 million for this project. We are going to have to find local investors to pledge and then provide about $2 million. I stress that these will be investors, not donors. That's a very important distinction here in the model that we're looking at. So over the course of the next 30 to 60 days, we're going to be looking for a limited number of people who are prepared to lend $25,000 or multiples thereof. We're going to provide pledge forms. The actual checks will not have to be written until March or April, when we're sure we get all the other approvals. In addition, we want to have committed leases by that point in time. So, and that's where the family health team comes in, because they will be leasing the entire second floor of the building, approximately 21 doctors and the related people that they have in the Northumberland Family Health team. And Mark can obviously better speak to that than I can. But that's sort of the overview. And we're at the stage, we're at the intersection where we need to make sure that we can raise the $2 million local. So we need to do this in a fairly short period of time, because that's going to be one of those intersections, and if we can't, then the whole project will be shut down. But we're fairly optimistic that those funds can be raised. I've been speaking to a few people, and we're getting close to the 400 to 500,000 range, and that's without any knocking on doors or public announcements. So we don't by any means have all the answers yet. This is still early in the process. You know, we're about 3 months into a 9 to 10 month process, so there will be a lot of detail, a lot of what I sometimes refer to as heavy lifting to do in the next 3 to 6 months. But that's kind of the overview of the business aspect. We will be incorporating a separate company, probably a not-for-profit corporation, and all net revenue will flow to the hospital from this project, from the rents that come in. The mortgages will be paid, and other, obviously, heating and all the things that you have with any building, but then net revenues will flow to the hospital in the early years. projecting at least $100,000, which will be a significant benefit to the hospital. And as the mortgage is paid down over the years, that number will of course increase, so that the payment to the hospital, when you get to 5, 10, 15 years out, the annual payment to the hospital should be very substantial. And there are a lot of other benefits to the hospital as well. But before I get there, do you want to cover some of the aspects from the doctor's point of view?
It's something that the family health team and as the group of physicians we've been looking at for about a year and a half, 2 years, and it will enable us to have our whole team together in one place, and allows us to better recruit physicians in the future when we need to replace physicians. So we are in a very good position right now for recruitment. Dr. Emery's just retired, and we had 5 applicants for his position. Having the building right beside the hospital will ensure that we're getting physicians that want to work in the hospital, provide hospital care along with primary care. Our goal is that it will make sure we have health care for the community for 40, 50 years. There's no reason that the physicians won't be located here for years.
Well, I don't know how many tenants. As I've indicated, 1 tenant on the 2nd floor.
Okay.
The 1st floor, probably somewhere 4, 5, 6. It'll depend on how much space a tenant wants, but I'm expecting it to be smaller units rather than larger units. But we don't know yet. There's no point of us having very serious discussion with tenants until we know that it's a go, right? There's so many things here that you have to get the sequence right on. So that will be reaching out to prospective tenants in the new year. There are some expressions of interest have already been received. The foundation does an excellent job for the hospital. I mean, we wouldn't, frankly, in my view, be open if it wasn't for the foundation, but they have a lot to do within their mandate. So we can't in any way ask them to help with this, and nor do we want to in any way hamper the projects that they do. They are dealing with donors, we're dealing with investors, and I might add as well that we're not looking to government for help on this either. We are not making an application. We feel that we can raise the $2 million locally, bring in $8 million from one of the chartered banks, and hopefully make this fly as long as detailed costing comes in around the $10 million. The question now is, if we don't raise the money, could we go to government and ask for financing? It's a possibility, but I don't see it in the present business model. Personally, that's just me talking. It's not the committee, because we have a committee working on this. 4 people from the hospital helped get this initiated, and basically 4 people from the family health team. And that's not been part of the discussion, and so it would be a whole new discussion, and the timeline would probably be impossible. But I never say never. And this is purely verbal. I had a phone call this morning from a person saying that they would. Because we have been talking to a number of people, right? You got to talk to bankers, you got to talk to other people. So this is why I wanted to share this publicly, because I felt it was time. In many respects, it's too early, because we may have to fold the tent, so to speak, in 60 days, which none of us would like to do. But on the other hand, we thought the message should get out there, to everybody, because otherwise there's sort of whispering campaigns about it. Things get distorted.
Of course.
Well, from my point of view, the sooner we can get this land taken from grass, and there's nothing wrong with grass, but I mean, stewards of land, we're really not doing a very good job of having land idle. If we can turn it into a revenue-producing asset that'll put money into the hospital coffers, I mean, I'd like to have seen it done 2 years ago. We would have had a couple $100,000 in coffers already. And it depends a little bit on which member of the group you're asking. But the doctors, as I mentioned earlier, need occupancy. The doctors need to move in by November of 2016, and you need most of a year for construction.
Why do they need to move in?
Well, we restarted the process. People may have heard over the years that the family health team was going to move into the Zelda's area, and that fell through based on delays that the landlord had. And as the group of physicians, we felt we would like to take charge of our own destiny. and we had to extend our leases where we currently are. Two of the clinics, one is owned by the group of physicians, and a good timing for us was the end of 2016. So we put out letters asking for interest from developers to see who would be interested in partnering with us in putting up a medical building. And so as a group of physicians, we chose the hospital. We felt it was the best alignment in terms of service delivery and also we felt the best for the community. And so it's our timeline that we need to be in by the end of November 2016.
The other location.
Our family health team, our allied health professionals are involved. So we have dietitians, social worker, mental health. We have a group of physicians across the road at the Cobourg Medical Center, a group across from East High School, and a group on University Avenue.
Okay, so 4 different locations.
4 different locations. We'd like to get everyone together and provide facilities. We're all really tight for space. We can't bring in new physicians. The new facility will allow us to also increase the number of new physicians. And then it's a partnership because the hospital has looked at it. I was involved in other times on the board looking at different options for a medical building, but I think just the time is right that everybody is working together to come up with a solution.
Well, a cafe owner would starve to death, I'm afraid, so I don't think a cafe owner is going to be in there, but a dentist, perhaps a physiotherapist, anything of a wellness type nature, I think would be good for them and good for the patients and good for the hospital. We haven't really touched on the benefits to the hospital apart from the monetary aspect. Having the doctors basically on site is a huge benefit, to the hospital. And, Linda Davis, the CEO of the hospital, or Mark could elaborate probably far better than I could on this, but it's very, very significant having the doctors available, sometimes just to assist with admitting one of their patients in terms of what they call the most responsible physician, from the point of view of perhaps not having to call in doctors from Toronto or whatever to cover certain things. There's a wide range of things, and it's also expected to help with recruiting and retention of doctors. This facility, new facility right beside the hospital, should be very attractive to bringing new doctors to the community as well. So that's just scratching the surface of the benefits to the hospital apart from the revenue that we anticipate.
I'm good.
Everybody okay?
Yeah.
I'm good. You're done? Okay, well thanks everybody.
Doug, can I just make a comment?
Sure.
I just wanted to make sure that everyone was clear that the hospital, in fact, will be leasing the land for the building. The hospital will not be owning or operating the building. Our role will be to lease a portion of the property. That does require Ministry of Health approval, and that's a piece that we are working through with the LIN. So I just wanted to be clear on that piece.